susunod po na testimony na maririnig natin. Ayan, si Ma'am Rochelle Binuti po is the wife of the patient po na si Sir Roman. Taga Davao City po sila. Yan. So, pakinggan po natin si Ma'am Rochelle at isi-share po niya kung ano po ang kanilang naranasan at paano po ang ating product, and of course, by the grace of God, ang kanya pong asawa ngayon ay doing well and fine. Yan. So, pakinggan po natin. Tune in lang po kayo.
Good morning, everyone. My name is Rochelle Benuti. I'm from Davao City. And my husband is the recipient of the PPARS Plus and PPARS and Cryptomonadales products, because my husband was diagnosed with squamous cell carcinoma, oropharyngeal. So that means it's the here, sa base of the tongue. He was diagnosed stage 4A, and immediately after his diagnosis, we went into treatment plans with the radiology oncologist and the medical oncologist. And the medical oncologist of 3 chemo cycles, while the radiology oncologist gave 35 sessions of radiotherapy. So, upon knowing that my husband is positive for oropharyngeal cancer, a good friend of mine, her name is Emmy Gross, I always, we're very close, I always confide with her. And I told her that Romano, my husband, was diagnosed with this kind of cancer. And then she immediately said, "Oh, Mars, you remember Bong Espina? He's here right now presenting these products to her dad, my dad," she said. "Okay," sabi ko, "Sige, ano Mars, I want to listen also." So immediately, she referred right away again Doc Bong to me. So si Doc Bong did not waste any time. He immediately got in touch with me, and to make the story short, he presented to us these products. Tapos yun nga lang, we were not able to use the PPARS Plus and PPARS right away because there was no stock during that time. But nag-start na kami kaagad gumamit ng crypto and the cleanse. So I immediately administered that to my husband. Tapos nung dumating na yung PPARS Plus, that was June 17, that's when we started that's when my husband started taking the PPARS Plus and PPARS. That was June 17. Yung radiation niya was 2 days after. And then yung chemo niya was about 3 or 4 days after. And so that means that there was only 2 days na na-administer ko yung PPARS and PPARS plus the crypto. But amazingly, when my husband took his first and second cycle of chemos, walang side effects ako nakita sa kanya. He was strong, he felt good about it. Sabi ko, do you feel like you're gonna suka? Sabi niya, no. Sabi ko, wow. Sabi ko right away na, wow. Naisip ko talaga na may effect talaga yung PPARS and PPARS Plus sa kanya. Knowing that there's only a few days na nasa start ko palang bigay sa kanya. Eventually nga, when my husband did not feel any side effects from the chemo, yung anti-emetic tablets na binili ko na very, very expensive, it's like 500 pesos per tablet. Eventually, dinonate ko na lang dun sa anak ng friend ko na also sick with cancer. Kasi sabi ko, hindi naman nagagamit eh. Why should we keep that when somebody could make use of it? So, dinonate ko na lang kasi hindi niya magamit yung anti-emetic tablets. Sabi ko, it's really because of the PPARS and the PPARS Plus. And then, but unfortunately, the radiation, as it went through 22 sessions, that's more than half of the 35 sessions. Diyan pa lang nag-set in yung yung side effects in the mouth. Considering that the radiation is concentrated here because the cancer is at the base of the tongue. So it's concentrated here. So wala talagang way na hindi maaapektuhan yung mouth niya. But considering that he was taking PPARS and PPARS plus the crypto, nakaabot pa siya more than half of the radiation treatments before nag-set in yung side effects na mouth ulcers and oral lesions. But then again, yun nga, because nag-set in, so hindi natin naiwasan na medyo bumaba yung resistance niya, yung immunity niya. He was rushed to the hospital. I rushed him to the hospital because of also probably inadequate nutrition kasi nilagyan kasi siya ng peg tube, and so all his nutrition was going through the peg na kasi hindi na siya makakain sa mouth. So probably there was also the inadequate nutrition, no, kasi milk na lang yung tinitake niya eh. Yun, to make the story short, na ICU pa talaga siya, na ICU siya for 4 days, and we stayed in the hospital for full 3 weeks. So during up to the last day nung sinugod namin siya sa hospital, naka-PPARS pa ako sa kanya noon eh. In fact, yung dumi niya, yung bowel niya was very green. Kasi naka-PPARS pa ako sa kanya, nakabigay pa ako sa kanya before we rushed him to the hospital. But then again, yung 4 days niya sa ICU, of course, na-stop kasi I could not give it in the hospital because I know for a fact that the medical doctors will not allow. Ayan. So, sabi ko, hindi ko mabigay yung PPARS niya kasi sigurado ako na the doctors, his team of doctors will not allow it. So, medyo na-stop yun pagbigay ko sa kanya ng PPARS. Including the few days na nalipat na siya sa room, complete monitoring siya sa room. Hindi ko pa rin mabigay yung PPARS niya kasi yung doctors niya kept coming in and out, tas yung mga nurses kept coming in and out of the room. Pero I was really thinking talaga na ibibigay ko, but I was just finding a way kung paano. And then eventually isip ako ng isip. One night that I was lying on my watcher's bed, sabi ko, kasi the doctors already came by and said nag-progress sa right yung pneumonia niya. And then from the CT scan, nagkaroon meron silang nakita that there are nodules on his lungs, no, on his right lungs, and some on the left. So when the doctor told him na there are nodules that was found in the CT scan, kasi nag-CT scan siya, my husband, he felt sad about it. He actually cried. But then I assured him that, sabi ko, don't worry. Huwag kang malungkot. Do not get sad and don't worry because we have the PPARS. I said, we have the PPARS. in my heart ba, also behind, at the back of my mind, I said, I'm not scared. Parang, ba't hindi ako natatakot na baka metastasis yun, and I'm not scared na hindi namin mariresolve yung ano niya, yung condition niya in the hospital. Sabi ko, I'm not scared. Sabi ko, we have the PPARS, we have the PPARS Plus. What could go wrong? But of course, hinahanap ko pa rin yung saan ako pwedeng mag-start magbigay. Kasi alam ko talaga sa hospital, they will not agree. It is not part of their principles and policy. So, as I was saying, I was lying down on my watcher's bed that night. It was almost midnight. My husband was sleeping on the bed, and we have a PDN, a private duty nurse, na nirecommend ng team of doctors niya because they had to monitor him nga round the clock because mababa yung blood pressure niya, and he was having episodes of mahina yung lungs niya, yung O2 niya, O2 saturation niya was very mababa, and he was having fever. So, naisip akong ganun. Sabi ko, Lord, tulungan mo ako. You help me find the right time and answer all my questions. Kasi, no doubt, hindi ko naman i-deny na there were doubts in my mind na safe ba ibigay ngayon, na hindi magkakaroon ng problema with all the antibiotics na nakasabit dyan, naka-infuse sa kanya. Napakarami niyang mga, parang Christmas tree nga yung ano niya eh. But sabi ko, give me the answers, Lord. Enlighten my mind, sabi ko. Ang dami kong questions, natatakot akong ibigay sa kanya kasi baka ako yung maging dahilan na lalong sumama yung condition niya. But in my heart, I know that I'm not scared eh. Hindi ako natatakot eh. But I still need your enlightenment, Lord, I said in my prayer during that night. And then all of a sudden, Doc Bong texted me right that very moment. It was almost midnight. Doc Bong said, "Hello, ma'am. Sorry po, hindi ako nakaka-text ngayon kasi busy. But how is Sir Romano?" Yun sabi niya. Sabi ko, wow, Doc Bong. Sabi ko, nandito na kami sa room, but he's been monitored round the clock. Tapos, I started asking him all the questions I was asking myself. Sabi ko, Doc, okay lang ba ito ibigay sa kanya? Gusto ko na siyang ibigyan ng PPARS ngayon. But natatakot ako kasi baka may interactions ba yan? Basta lahat ng questions ko, sinagot ni Doc Bong. And the only thing that he told me that made me get up on my bed, sabi niya, naku ma'am, kailangan ibigay mo na kaagad-agad yan sa kay sir kasi makakatulong yan sa kanya. It will help deliver the medicines, all the medications to the right place in his body. That message, made me stand up and tell the PDN, ma'am, meron akong supplements na ibigay kay sir. Explain ko sa'yo kung ano yun. Basta tulungan mo ako, ma'am, ha? Sabi ko dun sa PDF. Tulungan mo ako, ma'am. I want to give this to him. Sabi nung, buti na lang yung PDMs, they are very widely experienced. Sabi niya, sige ma'am, marami man kaming patients na nagbibigay ng ganyan. So, naintindihan talaga nila. Sabi ko, oh my God, I have 3 angels here that understands my heart ba. So, walang doubts yung PDN. The next day, sabi ko sa mga anak ko, dalihin nyo dito yung PPARS, dalahin nyo dito sa hospital immediately tomorrow So the next day, dinala nila yung PPARS sa hospital. And immediately pagkatanggap ko ng PPARS, binigay ko sa PDN. Sabi niya, ma'am, ibigay na natin ngayon to. Sabi ng PDN. Sabi ko, sige ma'am. Pagkatapos nun, binigay niya. And then, ladies and gentlemen, only 3 days after we were giving him the PPARS, the dosage I was giving him was 10, 10, and 10. 10 crypto, 1 tablet of PPARS Plus in the morning, 10 crypto, PPARS in the jar at lunchtime, and 10 crypto, 1 capsule of PPARS Plus in the night, in the evening, before his feeding. 3 days after, my husband started eating food. Nakapeg lang siya. And he started to feel rejuvenated. Na nasabi ng PDN sa akin na, ma'am, grabe masyado si sir ba? Okay, masyado na yung niya, parang lumakas good si sir. Gumanon siya. Sabi ko, wow! Sabi ko talaga. Sabi niya, ma'am, grabe talaga yung PPARS. Ginabigay mo, ma'am ba? Kasi, yung niya, yung antibiotic kasi pinalitan ng team of doctors niya because yung first antibiotic hindi nag-effect sa kanya eh. In fact, gumrabi nga yung lumipat sa right side yung niya, pneumonia niya. But after we've started giving the PPARS and yung bagong antibiotic niya umeffect talaga, which led us to eventually be discharged of the hospital. So sinasabi ko nga sa husband ko, let's give credit also to the PPARS kasi although meron kang medications, we are not saying we credit everything to the PPARS and PPARS Plus, but we cannot discount the fact that it helped you, it helped all the medications work for you, for your condition. Yun ang sinasabi ko sa kanya. And the PDNs can attest, 3 silang PDNs can attest to what happened. So, ngayon, my husband is walking every afternoon. He started walking very slow, right after we came back to the house. And paghapon nun, naglalakad na siya eh. Although mabagal, but slowly progressing, farther and farther yung nawo-walk niya. And he doesn't cough anymore. His mouth is getting well. Sabi nga niya na he feels better slowly by the day. And I thank the Lord for sending His angels to us, especially Doc Bong, because sinasabi ko nga palagi kay Doc Bong eh, Doc Bong ba, parang hulog ka talaga ng langit. You are the angel that the Lord is sending me. Kasi every time na may tanong ako, bigla ka umaapir eh. And may dala-dala kang grace from God. And if we hadn't known about the products, I don't know, baka hanggang ngayon bedridden pa rin yung husband ko. And kagabi, as of kagabi, he already cooked dinner for us. I couldn't thank the Lord for that, and I couldn't thank the PPARS and all the people behind PPARS for coming up with this wonderful and amazing product. If I could be, if I could only tell all the patients and the caregivers of the patients to try this, I'm telling you now, subukan niyo po. Give this wonderful product a try. because ako mismo, nakita ko talaga, and I can attest that it works, and it is effective, and it is not only nandyan lang yan. It is a gift from God. It is a gift from God that we should accept and we should embrace, because God doesn't leave us astray. He's always giving us something to be thankful for. He's always giving us healing. He never leaves us alone. Every day in my prayers, sinasabi ko, Lord, thank you because today hindi siya umuubo. The next day, I will thank Him again. Lord, thank you, Lord. Naglakad siya ng 1 kilometer today. The next day, I will thank Him. Lord, thank you. Kasi umiinom na siya ng maraming tubig. Only little by little, all the small things, I am already very grateful for the Lord, because I have seen how my husband was in the ICU and he's strapped to all these machines. And I'm grateful that the Lord enlightened me na kahit na alam kong bawal sa hospital, hindi ako natakot. Sabi ko, hindi ako matatakot kasi wala namang masama dun sa binigay ko. In fact, tinulungan ko pa sila to make their job easier. So, yun po. That is my testimony in behalf of my husband. I thank everybody behind Noble Life International for coming up with the gift that the Lord has given us. Thank you very much, and God bless us all.
Ayun. So, maraming salamat din po, Miss Rochelle. Yan. So, ito na po si Sir Romano po ngayon. Yan. Makikita niyo po siya. Ayan po siya. Yan. So, one thing na napakaganda with this testimony is they never forgotten that God is the healer po. So, they lifted up po lahat kay Lord. Kaya po, the blessing of healing po ay ginawad po ng Panginoon sa kanila. Yan. So, sabi nga po niya, yan na po si Sir Romano ngayon, yung wife po ni Ma'am Rochelle. Yan. So, thank you daw po for PPARS and Cryptomonadales.